Right now, more than 1 in 8 American adults has tried a GLP-1 drug. Ozempic, Zepbound, Wegovy, Mounjaro. And if you're one of them or thinking about becoming one of them, there's something happening inside your body that almost nobody explains clearly. It's not just fat melting away. Your liver is shrinking. Your muscles are changing in ways scientists are still arguing about. And the moment you stop taking the drug, your body starts a quiet countdown. Stick with me because by the end of this video you'll understand exactly what's going on under your skin and whether the trade-offs are worth it for you. Before we get into it, if you find this kind of deep dive useful, hit like, subscribe, and drop a comment telling me if you or someone you know has tried one of these drugs. I read every comment and honestly, some of the best insights in this video came from viewers just like you. The hormone hijack. Let's start with the basics because most people think Ozempic just suppresses your appetite like a switch flipping off. That's not quite right. What's actually happening is more like a hormonal infiltration. GLP-1 stands for glucagon-like peptide 1, a natural hormone your gut already produces after you eat. It tells your pancreas to release insulin, slows down how fast food leaves your stomach, and sends signals to your brain that say, "I'm full, stop eating." Drugs like semaglutide, the active ingredient in Ozempic and Wegovy, are lab-made copies of that hormone, engineered to stick around in your bloodstream for days instead of minutes. Tirzepatide, the ingredient in Mounjaro and Zepbound, goes a step further. It mimics 2 hormones instead of 1, GLP-1 and GIP, essentially double-tapping your body's fullness signals. That's part of why head-to-head research found something striking. In a direct comparison published in JAMA Internal Medicine, patients taking the highest dose of Zepbound lost around 21% of their body weight over 72 weeks, compared to around 15% for patients on Wegovy after 68 weeks. Picture it like this. Your stomach is a room and food used to walk in and out quickly. Now there's a bouncer at the door, slowing everything to a crawl. Your brain, meanwhile, is getting a non-stop text message that says you're satisfied, even when you've barely eaten. People describe losing what's now commonly called food noise, that constant background hum of thinking about your next meal. For some people, that hum has been running since childhood. Turning it off for the first time can feel almost disorienting. But here's where the story gets more complicated than the ads let on. The shrinking organ nobody talks about. You've probably heard the muscle loss debate. We'll get there. But there's a stranger finding buried in the research that deserves more attention than it's getting. A study published in Cell Metabolism looked at what semaglutide does to mice, then confirmed some of the mechanisms in cultured human heart cells. Researchers found the heart muscle itself appeared to shrink. Separately, other animal research found the liver shrinking by nearly half in some cases, a far bigger drop than muscle mass saw in the same animals. Now, before you panic, this research is early, mostly in animal models, and scientists are careful to say the human implications aren't confirmed. But it raises a genuinely important question. If a drug is powerful enough to shrink an organ as central as the liver, what else is it quietly reshaping that we simply haven't measured yet? This is the uncomfortable truth about GLP-1 drugs in 2026. They arrived so fast and became so popular so quickly that the long-term safety data is still being written in real time, even as tens of millions of people are already using them. The muscle question answered honestly. Okay, let's talk about the headline everyone's seen. Does Ozempic eat your muscle? The clickbait version says yes, catastrophically. The truth is more nuanced and honestly more interesting. Clinical trial data on semaglutide has shown lean mass losses in the range of 13.9% during treatment, equal to roughly 15 pounds, and some experts have described total lean mass losses across GLP-1 drugs as equivalent to around 20 years of natural age-related muscle decline compressed into a little over a year. That sounds terrifying. But there's a catch that almost never makes it into the scary headlines. Lean mass, the number these studies actually measure, isn't the same as muscle. It includes water, connective tissue, and organs. So when the liver shrinks, that shows up in the same bucket as muscle loss, even though your biceps didn't change at all. That's exactly what a newer 2026 study in Cell Reports Medicine found. Researchers who separated out the details discovered something surprising. Liver mass dropped more than muscle mass did. And while absolute muscle mass and strength went down slightly, relative muscle mass and running performance actually improved. In other words, once you account for the fact that the whole body is smaller, the muscle that's left may be working just as well or better than before. There's also a distinction between the two drug classes worth knowing. Semaglutide's trials show a higher share of lean mass loss than typical weight loss, while tirzepatide's trials show the same ratio as placebo, meaning the drug itself may not be the primary driver there. And here's a fact that should honestly reframe the entire panic. Losing muscle alongside fat isn't unique to these medications. It's a basic feature of rapid, sustained weight loss by any method, diet, surgery, or drug. The so-called quarter rule, where roughly a quarter of weight loss tends to be lean mass, shows up across plenty of non-drug weight loss research too. None of this means muscle loss is a non-issue. Some researchers have found a strange mismatch where certain muscles stay the same size but lose strength, which could point toward frailty risk, especially in older adults. That's a real concern, and it's part of why doctors increasingly recommend resistance training and adequate protein intake as a built-in part of any GLP-1 treatment plan, not an optional extra. The body you don't see on the scale. Weight loss drugs don't just work on your stomach and your muscles. They seem to be rewriting parts of your biology that have nothing to do with your waistline. Take your brain. A 2025 study evaluating people with diabetes found that those using GLP-1 drugs had a lower risk of developing Alzheimer's disease and other forms of dementia. Nobody fully understands the mechanism yet, but the leading theory involves reduced inflammation throughout the body, including the brain. Then there's cancer risk. A large study found that women taking GLP-1 drugs were roughly 30% less likely to develop breast cancer, a finding researchers are still trying to explain, possibly tied to reduced insulin resistance and lower systemic inflammation. But it's not all good news hiding beneath the surface. The FDA has tracked a pattern of hair loss reports among GLP-1 users, something not officially listed as a side effect on any label, but common enough that dermatologists now see it regularly. Most of it appears to be triggered indirectly, by the stress of rapid weight loss itself rather than the drug attacking your hair follicles directly. There have also been reports linking these drugs to a rare eye condition affecting blood flow to the optic nerve, and ongoing lawsuits alleging manufacturers didn't adequately warn patients about severe gastroparesis, a form of stomach paralysis. This is the real dilemma. For every reassuring study, there's a cautionary one sitting right next to it. And that's not a reason to dismiss the science. It's a reason to take it seriously enough to ask real questions before you start. What happens when you stop? Here's the part almost nobody prepares you for. Roughly half of people who start GLP-1 drugs stop taking them within a year, whether due to cost, side effects, or simply feeling like they've reached their goal. For a long time, the assumption was that stopping meant an inevitable dramatic rebound, all the weight piling back on within months. But a large real-world study of nearly 8,000 patients found something more reassuring. Most people who discontinued treatment did not experience the severe rebound many feared. That said, researchers commissioned by the World Health Organization have flagged something important. Once you stop the medication, the underlying appetite and metabolic signals that made losing weight difficult in the first place tend to return. Your body isn't broken by the drug. But it also doesn't appear to be permanently rewired by it either. The hormone hijack ends the moment the medication leaves your system. There's another wrinkle worth mentioning. Researchers analyzing Fitbit data from GLP-1 users found something unexpected. People taking these drugs weren't just eating less. Many were also moving less throughout the day, a change that could quietly work against the muscle and metabolic benefits the drugs are supposed to provide. The bottom line. So what's the actual verdict? GLP-1 drugs are neither the miracle cure the ads promise nor the dangerous shortcut the scariest headlines suggest. They're a powerful hormonal intervention that reshapes your appetite, your organs, and possibly your brain's long-term health, all at once, and scientists are still mapping the full picture in real time. If there's one thing worth remembering, it's this. Weight lost on these drugs behaves a lot like weight lost any other way. It comes with trade-offs, it requires effort to protect your muscle and strength, and it doesn't erase the underlying biology waiting for you if you stop. This video is general information, not personal medical advice. Any decision about starting, continuing, or stopping a GLP-1 medication should happen with your own doctor, who knows your history and your body. If this helped you see through the noise, subscribe for more videos that go past the headlines and into the actual science. And let me know in the comments, has a GLP-1 drug changed something in your life you didn't expect?